Welcome back to the Aesthetic Blueprint, the official podcast of Symplast, the all-in-one platform for medical aesthetics and plastic surgery. My name is Jes Wisner. I'm the head of client education and product evangelism here at Symplast. And today I am thrilled to be joined with, I think, two of my favorite people at the company. I mean, I don't want to play favorites, but our paired power duo, our regional vice presidents, Neil D'Amico and JJ Jankowski. Welcome to the podcast.
Thanks, Jess.
Thanks for having us.
Yeah. Now, is this, just so we know where we're starting, is this your first podcast ever?
It is.
Yeah, this is number one. Be gentle.
Number one.
Be gentle. I'm going to do my best. But, it becomes a little addicting. So fair warning. So anyways, one of the things I really wanted to bring you guys onto the podcast for was that you guys are in the field every day talking to the doctors and the practices, that were, oftentimes have pain points, and it's starting to, they want to look for a new solution, a technology solution for their practice. So what I was hoping to talk about with you guys today was really like, what is the commonalities that you're seeing where practices are just feeling like, they're not getting what they need out of their current platform, or just day-to-day pain points that they have?
Yeah, I think one of the things that Neil and I have had conversations before that really stands out is the reporting. Data is paramount, and understanding what's going on within their organization, not only from a medical side, but also from a business side. I think this is such a unique industry in the sense that these are essentially all small SMB companies, essentially. So the doctor,
they really are. Mm-hmm.
The doctors are the CEOs, as they are also, being that surgeon. So being able to provide them at their fingertips to have the information so that they can grow and thrive is critical for them. And they have found that a lot of times that's really lacking in the other solutions that are out there currently.
Yeah. Neil, is that a common thread that you hear as well?
Without question. A lot of times, practices, they don't have good insights. They don't know exactly what's going on within their practice. And when we're able to show them, through our dashboards, through our business insights within Symplast, a lot of times their eyes open. And they have no idea, these are the conversion rates that we're seeing, say, from consultation to procedure, revenue across the board.
Yeah. So reports, I definitely hear that a lot as well on the client success side for, even current customers, is they are always asking for training and additional insights to help them with those reporting metrics. KPIs is definitely a hot topic. Are there any reports in specifically that you guys hear a common ask for?
So I think one of the things that I've heard asked for is really where the revenue is coming from, being able to understand, hey, what is our not necessarily profit margin, but hey, where are we driving that revenue? Who's being responsible for it? What are the things that are being asked for? And being able to tie that. One of the things that also I've seen more is being able to attribute to the patient care coordinators. Who's responsible for those conversations? Is there someone that not only being able to make sure that they're getting credited for that, but also being able to track who is actually helping drive the business into the practice? So
productivity then.
Very much so.
Yeah. Now you guys both came from other EMR style solutions, but different medical fields. So JJ, I believe it was veterinary, correct? Yeah. And then Neil, which category were you in?
So I was multi-specialty at Modernizing Medicine for just shy of 8 years.
Okay. And are these kind of common themes that you guys heard on those sides as well?
Definitely.
Yes, so I'm always very careful when I say this, but there's so much of mirroring of what I saw in veterinary medicine to the aesthetics, and I don't mean from the patients, the clientele. It's very different.
Of course, dogs and humans are totally different.
Completely different, but operationally they mirror each other very, very very closely, and the same challenges that we would see in those practices are the ones that we see here. For me, coming into the industry, it was actually much more seamless than I expected. I was able to pick it up because there was that common thread from a business side that I was able to really lean into and use my experience.
Yeah. Neil, how about you? I mean, multi-specialty, you dealt a lot more with the insurance side, right? You saw a lot of insurance accepting providers, whereas, similar plastic surgery and veterinary definitely have more in common as far as being cash-based practices. But what kind of shifts have you seen or differences do you see between, those multi-specialty clinics and someone who is specialized, like a plastic surgeon or a med spa?
Well, I think one of the things that you're seeing is more and more plastic surgery practices are getting away from insurance in every way that they can. Mm-hmm. And from a product perspective, knowing that some of these other platforms that are out there provide, a good platform for someone who's doing, say, 80 to 90% insurance, but other workflows don't necessarily match up to the same specific for aesthetic space.
Yeah.
It's not what they're looking for. So, you may have another vendor who's out there who's in dermatology, ophthalmology, orthopedics, ENT, GI, urology, podiatry, you name it, right? And when you're in that many specialties, it doesn't allow you to be an expert, in one, right? You're trying to retrofit too many things in. Maybe you have one flagship product that is kind of your baseline, but it's a different kind of workflow. So from the payment standpoint, from the clinical standpoint, it just ends up being very different.
Yeah. JJ, have you seen that quite a bit as well of the people that are looking to switch off of, those, not quite as specialized as Symplast platforms, I guess, for lack of a better term?
Yeah, absolutely. I think there's a common thread that when we have that conversation, especially if they're not maybe familiar with Symplast, that when we explain that, hey, we were founded by a plastic surgeon, we were built for plastic surgery and aesthetics, and that's all we do. I think that really resonates because we understand their operational needs, and that we are, to Neil's point, we have all the capabilities that they need just for them. We're not basically putting on an add-on for from something that would be for major medical.
Yeah, I think that's a really fair point because it is such a specialized industry. And, I came from the med spa world, but we also did do insurance billing on, another side of our practice, which was also a specialty field. But it is a completely different animal. And I know that was a challenge for us, was trying to find that chupacabra software, for lack of a better term, that mythical legend of a solution that could kind of do it all, but still meet that specialty need. So what other kind of commonalities do you guys often hear between the different practices that you're talking to as far as like technological pain points?
Well, I think one of the things is, most practices historically that have been around for a little bit have started building these Frankenstein systems, right? They're utilizing multiple platforms from a tech standpoint. So, when they learn a little bit about Symplast and they see that we're really that all-in-one solution from practice management, EHR, CRM, everything AI-powered, it becomes impressive to them for them to go, wow, I can get rid of 7 or 8 different systems, where a lot of other vendors that are out there, they know that they've got to continue to find different ways to integrate and what does and doesn't integrate, what's a unidirectional integration versus bidirectional and how data flows, what's going to happen when they, later on down the road, when they want to potentially retire or sell their practice, how they're going to handle the data. Just makes things much easier when they're going through that one ecosystem than, like I said, that Frankenstein.
Yeah. It always, I don't know about you guys, but it always blows my mind that, we have providers so desperate to try to come up with solutions. And I say this with all the love in my heart, of course, that they're invested in Salesforce, which always, the least specialized platform ever. And this is not to call it anyone that hasn't necessarily directly, of course, but, it's that desperation for finding a technology solution because what their current platform is doing isn't quite hitting it. JJ, do you see that a lot as well?
I do, and I think the thing that I was thinking about is I've heard so many times that it's too good to be true, hearing those because they're so used to having to piecemeal everything together, and it doesn't really work. That when we're describing it, they're like, there's almost like that trust but verify, because it's never existed before, and when we are able to demonstrate it, you really just see their eyes open, going, oh wow, this is pretty amazing.
Yeah, I think, another topic, certainly here at Plastic Surgery, the meeting, full transparency, that's where we're recording again, but the common theme, technology-wise, at the meeting has been AI, right? Mm-hmm. You guys talk to a lot of practices. Do you see a lot of practitioners implementing AI or already having AI or just looking for a solution or hesitant about it? What's the pulse with all the different practices that you guys talk with?
So I think, excuse me, I think a lot of physicians and surgeons, as they see what we offer in AI, it's drastically different than what a lot of other groups are doing, where everything is integrated directly into the chart. So having something that is HIPAA compliant, that transcribes, that puts everything directly into the note, that is multilingual, and then gives you actionable next steps, is so much different than just straight up AI dictation tool that you may see that's completely in a separate system that still has to be imported in. So I think a lot of surgeons are open to it, and I think they've got kind of a misconception of what it's actually going to be, and that it's going to take some of the actual medicine out of it. So what I've seen is people are very, very reactive to it.
Yeah, and to your point, like I think most are open to it. Some of them are not, because they think it needs to come further.
And I think that's fair. It's a newer technology, so yeah.
But I think when they actually see it and they use it, I think that's kind of the aha moment for a lot of them, when if they're, especially if they're doing it manually, or they're having their nurse scribe for them, and then being able to show, and when we have demos, recording that quick snippet, and they get to see it in real time, and they go, oh, this actually works. I think for a lot that it's pretty impactful for them, because they realize the time aspect of it. And I think that's probably one of the things that's so really that I love about our product, is that we have the ability to provide so much more time, not only to the physicians but to their staffs.
It's funny you say that about the time. There was a surgeon who I was speaking with yesterday who literally said that he spends anywhere between 6 to 8 hours on the weekend, doing additional chart notes.
Oh, wow.
Literally just to be 2 weeks behind in keeping up with his notes.
So sad.
So
Yeah.
in having that conversation around AI, his eyes lit up, is going, wow, right off the bat, he could see how much time that's going to save him. And he was like, really, this is going to, save the recordings. It's going to, everything's going to be, it's going to be seamless, and everything's going to just be done for you.
And I think our product goes beyond the AI on that, because it's mobile first. That the capabilities that it allows them to be connected anywhere at any time. I've been telling this story because I really was a real world example of just how impactful our software can be. I had the honor of playing golf with Dr. Johnny Franco a couple weeks ago in Texas.
He's such a fun guy.
He's awesome.
Love
great.
him.
and he had to manage an issue for a patient that on the clinic. So he was literally able to log into our system on the golf cart in between holes and manage it and take care of it right then and there. So it's not something that lingered. It provided a better patient experience because he was able to take care of that and address that for that patient right then and there. And we weren't interrupted. So I think that was kind of the thing that just like, hey, you're able to take care of everything anywhere, and now you're not beholden to either being at the practice to be able to do this, and be able to just provide an awesome experience, not only for himself but for everyone.
Yeah. So you guys have now been in the plastic surgery and med spa world for a good 5-6 months now. I can't remember exactly when you guys started, but what is coming to something like plastic surgery, the meeting, you get, really good insight into like what everyone's going on, and you get to work with the doctors, meet with the doctors. And I know the opening ceremonies of this, the Patience of Courage, is always impactful to me. I mean, I think Pete and I talked about this when I interviewed him. There was a little dust in the room, right? What is your thoughts like working with these plastic surgeons, and like, your impression of the industry as a whole, and, what they do? Anything that has been particularly impactful to you, I think?
I think it's amazing, especially on the reconstructive side of things. You mentioned the Patience of Courage, that blew me away.
Absolutely.
The stories that were shared on the patient, and the fact that the patients were here, I thought was outstanding. You can see the impact in the lives that these plastic surgeons are making. And obviously that's happening on the cosmetic side as well, building confidence and everything like that. But for me, the reconstructive side just really hits home, because when you hear the stories of families, the one, I apologize, I can't remember her name, where she had sepsis and all 4 of her extremities had to be amputated, and to see her walking and dancing again, like, that is life-changing,
Really is.
So those are things that just instantly hit home with me.
Yeah.
I think the thing that I have really recognized is they're innovators. They are constantly trying to push the envelope for better procedures, better outcomes for both for the ones that are reconstructive, but also for the ones that are just looking for aesthetic.
Yeah.
So I think they're artists.
Truly.
And
it's not even necessarily just vanity based, right? Which I think is the unfortunate thing that, you sometimes people that aren't familiar with the industry and what these doctors are really like is they put it in that kind of, bucket unfairly. So I think. Yeah, JJ, sorry, I kind of cut you off there.
No. I mean, I think I completed my thought, but I think that's the thing. It's you. Like I said, I think of the innovating artists. Like that's what they are. These guys are brilliant, and what they're doing, and I think is how quickly the things keep evolving. Mm-hmm. Everything is getting better and better because they're pushing the envelope to really make sure that is the case.
Yeah, I have so much respect for surgeons. You guys probably know a little bit of my personal story. I have a daughter with special needs, and she had many a surgery the first 5 years of her life, and really opened my eyes to the impact a surgeon has, which I think is why being at Symplast, it really drives me. Because it helps the surgeon spend more time with the patient, which is what it's all about, right? There's nothing worse than going to a doctor's appointment and watching them just typing away at notes. Yeah.
Yeah, and I guess bringing it back to the AI, that's exactly what we are able to allow them to do, because now they can have that face-to-face interaction. They don't have to have their face into a tablet or writing notes. You can look and interact, and that.
It's such a personal experience. So
truly,
obviously, when you think about quality of care, but no matter what it is that you're going in for, when you have that consultation, like you're opening up yourself, you're opening up your heart. A lot of times you're very, very vulnerable, right? Mm-hmm. And that is something to what JJ was saying. The tech should never be, a boundary between you. Mm-hmm. And I think, JJ mentioned about them being artists. Could not agree more. But I think it allows even just that connection, that human connection. And I'm sorry, I'm probably restating a little bit, but it's such an important factor. I know myself, I am awful with doctors as a patient. I'm a miserable patient. But when I have someone who's got that, that I can connect to and feel like, hey, listen, I know they're understanding. It's not just them going like, okay, well, this is what I'm going to do. This is where I'm going to put my scalpel. No, I understand the deeper reason why this person's coming to me. Mm-hmm. Makes all the difference in the world.
It really does. It really does. Well, I know we've gotten a little long in the tooth maybe here, but, Neil, I apologize we did not get to your beef Wellington recipe. I know that was what you were hoping the podcast would be about, but, we'll save that for another time. But any final thoughts you guys want to just throw out, put a little pin in it?
I was curious how, for me coming into this industry, how much I love it. Like it very much. I'm having so much fun, and it's just been amazing the people I've gotten to meet and now working with, and it's been so much fun working with the surgeons as well.
Yeah,
absolutely.
And just such a tight-knit community too. More so than some of the other specialties that I've worked in the past. Everybody knows one another. There's such a high level of respect for one another. I've been able to learn such a tremendous amount in the time that I've been here. I'm, excited to see what I'm going to learn in the next 6 months. So I think, JJ and I have stepped into a fantastic organization, into a fantastic industry, one that we can both really, sink our teeth into, and just excited.
Mm-hmm. And the very last question for you guys, I promise. What is different about Symplast compared to the other companies you work for?
I think the thing that stood out to me immediately was the lead by doing example set by Facundo, our CEO. I have never seen a CEO be that as hands-on as he is, and in the trenches.
He's in everything,
whether that's literally helping set things up. I mean, he is doing. I think that's probably the thing that has stood out to me the most. Of it is so unique in that sense of culturally. Of seeing someone truly leading by example.
Absolutely. Neil?
Yeah, I would say twofold. One, from an internal standpoint, the team is just outstanding, obviously led by Facundo, but the entire org, coming in with limited plastic experience, being able to learn from you and the entire group.
And I'm sorry, you got my crash course on. Here's everything you need to know about the industry in 1 hour. Go.
but it's been tremendous in that point. And then obviously the values that the company has, right, from integrity and accountability, determination. These are things that it's not just one area of the company that it's being pushed in. It breathes through the entire organization. And then the one other thing I did want to mention is for me coming in, something that blew my mind was how many not just happy customers, but customers that were eager to be evangelists eager to give testimonials, share case studies. A lot of organizations, you have to really, really push somebody. Hey, listen, what do we have to do to incentivize you? There is no incentivization whatsoever. I'm blown. Every time I'm, at a show, I've already been, I think this is show 6 or 7 for me since I've been here. And to see the customers come up and be excited to film videos and share their thoughts and their experiences and give feedback, I think it's just tremendous.
Yeah.
And I think that's where we can plug you, Jess. In all seriousness, that when they have feedback, it gets listened to.
Right.
And
It's the favorite part of my job.
And we truly will integrate that into what we're doing, as we are always trying to innovate our own product, that we are taking their feedback, and that when they share an opinion, it's actually listened to. It's actually valued. That they can be part of our evolution, and that if they have challenges, we will meet it head on and we will find the solution for them.
Absolutely. Yeah. And, I'll just say that is my favorite part of my job. I love going to practices and talking with practices and being like, yeah, that's a great idea. Let's do that. And then bringing it back to the team. I love that. So anyways, thank you guys so much for humoring me and coming on my little podcast. But seriously, we're so lucky to have you guys here and working together as kind of that unified force. Just enjoy working with you guys. So thank you so much for coming and sharing your thoughts and your impressions so far. So hopefully a year from now, we'll have some more to talk about as you're a little further into it. But really glad to have you guys on the team. And thanks for coming in and chatting with me today.
Likewise, Jess.
Thanks,
you.
Jess.
All right, thanks. We will see you guys on the next episode. Thanks so much.